Hi, I'm Mark McMahon. I'm a physical therapist at Revolutions in Fitness. And today we're going to talk about a movement that is very important for function. We can use it as an assessment for people with back pain, and we can teach it as an exercise for the same people, and also for people who just want to get stronger with their athletics. The movement is hip extension, which is just simply the hip, the leg being brought back behind along with the pelvis and to some degree the lower back. It's a very important movement for walking, as you might imagine, propulsion, running, even standing. Research has shown that there's a normal sequence of muscles that fire to get this motion accomplished, and then there's alterations in that sequencing that can happen when you have back pain. So if someone has had low back pain, those muscles are not going to be firing in the right sequence. In general, there's deep muscles that help the spine stabilize, and then there's a layer of superficial muscles which move the leg and pelvis. And if in a normal situation, the deep muscles fire first and then the superficial muscles fire second. In the altered pattern with back pain, sometimes it's the other way around, which unfortunately can perpetuate the problem of compression and pain. So we want to use this motion for an assessment to see if they have this synergy, this muscle patterning. And then we want to teach it as an exercise to promote the normal muscle firing. So I'm going to go down the table. I'll show you what I would do and what you can do. As a disclaimer, as a warning, if any of these things we try give you back pain, it's not worth pinching your back to do this. This is something we would sort out in the clinic, but just be careful with this motion. It can be a little bit challenging. So I put a couple of pillows under my belly so my spine doesn't go all the way down into arching or extension. So if I just ask my leg to lift, it lifts, but it's not much beyond the leg. And so my pelvis hasn't really gotten into the motion. And that's what we see a lot with people who've had these muscle firing problems. Either that or they go up into a big arch without a lot of finesse. But here I'm going to lift my leg and pelvis off the ground on that right side. And then for the exercise component, if that's comfortable, I would just simply ask you to hold and continue to hold. And at some point there may be a sense of fatigue and or shaking even. But the idea of this is that if we persist through the shaking, which is really basically those superficial muscles getting tired, and then it creates the condition where the smaller, deeper muscles have to come in. They're the core muscles, basically. So even now I can feel my abdominals kind of coming in and helping. And then if I continue to persist, I could add length. I could think about lengthening through this leg. Now you know why we call the exercise the ballerina, for good reason. And then I could also turn my head over and look over that shoulder. That gets me a little more of that combines to get the better, deeper muscle groups working sometime. Try that. And then the second version you might try would be off the edge of a bed or a table or on a ball. If it's a little more easy to get into, this is fine. We can also do the same thing here. I lift the leg, I lift the pelvis, and I hold with long leg, ballerina. Prolonged hold. 1 or 2 prolonged holds is a very good way to wake up the lumbar extensors and to promote normal firing of your muscles. Thanks.